Hi, Jared.
Hey Dan.
Hi.
Hi,
Hi, how are you?
good to see, well, some of you. There's a lot of people I think I don't know here since I haven't been
Oh yeah,
around for a while.
these has slowly grown, and Dr. Jerrod Brown brings a audience both of clinicians and brain injury people, and I've been recruiting for the next round of these talks, new people through just trying to get people to talk, and found some cool research that is like at that convention I went to. I think over the last 4 or 5 years, I'm actually seeing like, let's put, the research is like catching up with what I've experienced since my TBI in 1999. And so
I,
that's,
I agree. Yeah,
yeah.
it's kind of exciting.
So hi everyone, thank you for coming. My name is Daniel Avasar. I'm a brain injury survivor, and this is the Building Brain Awareness talk series. So this talk series is about getting into details and information and topic by topic, deep look at brain injury specific issues. And today, Dr. Jerrod Brown is going to present on brain injury and the HPA axis, the hypothalamic-pituitary-adrenal axis, which is a network of brain regions that regulate hormones and are involved in stress and threat and fight or flight response. And I think it's a really fascinating topic. I think that this is an important topic for any kind of trauma, but brain injury is different and similar. So there's a lot of overlapping factors. I just wanted to say that in my talk series, I've been recruiting people for to give talks for the next year, and Dr. Jerry Brown is going to give a number of talks in the next year as well. But I have found other clinicians and some brain injury survivors to do a panel with. Okay, with that, Jared, take it away.
Great. Thanks, Dan. Hope everyone's well. Thanks for tuning in today. I have a really bad cold, so I'm just letting you know if my voice goes in and out, that's why. So my name's Jared. Here's my email address. Reach out if you have any questions. I've been giving talks on the HPA access for several years now, and it's a really fascinating topic, as Dan said. It has significant implications for human health and well-being. Now, obviously, the focus is on traumatic brain injury as much as possible, but pretty much the majority of what I'm talking about can be applied to any kind of scenario, situation, condition. We're going to talk about all kinds of things today, including a lot of strategies and interventions. Our agenda is very straightforward. I got three parts today. I'll stop after each part, open it up to any thoughts or questions. Anybody here has any other additional insights that I didn't cover, please feel free to share it with the group. We're all here to learn from each other. And we got a lot of information we're going to cover today. So I know Dan records these, so I definitely encourage you to go back and listen to this if I do move too quickly. So we'll talk just a little bit about the basics of the brain injuries, but just this kind of sums it up here, I think. So when we're talking about brain injuries, all of you know about brain injuries, obviously. We know there's all kinds of comorbidities, primary and secondary kinds of factors we need to be aware of. And if you look at this visually here, and this is not an all-encompassing list, why do we want to study the HPA axis when you learn about brain injuries? Well, I think this slide here really hones in on that because when somebody sustains a brain injury, and a lot of factors need to be taken into account. Obviously, the type of brain injury, the location, the severity, pre-factors and post-factors need to be taken into account. But autonomic nervous system dysfunction after a brain injury, very, very common. Dan, I believe our talk last time was on autonomic nervous system dysfunction. So whenever that video is released, folks, if you're interested in that, check that out. Anytime you study the HPA axis, you got to learn about the autonomic nervous system. Look at all these other things that can happen as a result of a brain injury. A lot of gut health issues. We'll be talking about that. I'll be doing an episode for Dan later this year on traumatic brain injury and the gut-brain axis. And part of the gut-brain axis is the autonomic nervous system, and the HPA axis plays a role here. So they're all interconnected. And when one is off, a lot of times it can impact these other systems. This is just a little research literature about traumatic brain injury in conjunction with the HPA axis. And I always send my slides to Dan, so I know he sends them out to folks. So you'll have these exact same copies. And Any of you are researchers or just nerdy bookworms like myself, I got full citations at the bottom of each slide, so definitely check those articles out. But some literature indicates that maybe as many as 25% of folks who sustain a brain injury are going to be dealing with something not working properly in the HPA axis, the hypothalamus-pituitary-adrenal axis. What do we need to be aware of? Why do you want to care about this in conjunction with brain injury? Because if somebody has HPA axis dysfunction, what happens to them on a cellular level? It throws off inflammation. And if any of you have studied chronic low-grade inflammation, you know that's a driver for most diseases, illnesses, and disorders. It's related to depression. It's related to neurodegeneration. So if somebody's dealing with chronic inflammation in their body over a very long period of time, that speeds up the aging process. Now we're talking about allostatic load, biological despair, blood sugar imbalances, all kinds of stuff. The HPA axis plays a role in all of that. And we do know that many people, unfortunately, who are survivors of the brain injury do experience sleep-related issues. Last year, I gave, I think, at least 2 talks for your group, Dan, on different dimensions of sleep. I think we're doing another one, if my memory serves me right, on sleep apnea and brain injuries this year. Correct me if I'm wrong, Dan, but
Yeah.
sleep issues are a big thing too.
Yeah, we got into a lot of sleep-centric issues and then circadian rhythm, and then you had talked about the breathing and sleep apnea being one more, so we have added that to the list. The 2 sleep talks are out there. The autonomic nervous system one that you had just mentioned is the next thing I will get out.
Perfect.
Yeah.
So if any of you are living with a brain injury right now, or maybe you're a professional who works with somebody with a brain injury, and that person deals with a lot of sleep issues, what do we need to know about that? Well, I think it's very, very important to also work with providers who understand the HPA access because that is a piece of this puzzle why so many people with brain injuries have sleep issues. So, traditional sleep interventions, do they work for people with brain injuries? Sure, in some cases, maybe sometimes not. So, what could be the missing link? Maybe it's working with a provider who really understands how to calm down the HPA axis. That might give some other avenues for intervention that you might not have thought of. And we'll talk a lot about interventions today at the end. All right, so the HPA axis, again, now getting into the basics, it's the hypothalamus-pituitary-adrenal axis. It plays a very critical role in the human body's stress response system. All humans have the axis. We all deal with stress. If it's short-term stress, that's normal. Our axis kicks in, it does what it's supposed to. What happens if somebody's dealing with chronic stress year after year for decades? Well, that short circuits the system, and it's not a good thing. The end product of this axis is cortisol. Cortisol is a very good thing. Too much is not good, and not enough's not good. We'll talk about that today as well. So this is just a good reminder. Why do you want to study this? Well, when the HPA axis is working properly, it helps us cope better with stress and life circumstances. It plays a role in resilience, and it plays a critical role in maintaining homeostasis in the body. Homeostasis is just kind of in balance. When you feel chill, you feel relaxed, you feel calm. That's a good thing. Breaking this down a little bit further. So we all know about the prefrontal cortex. We all know about executive function. We know that executive function impairments are a very important area to consider when you're working with somebody with a brain injury. The HPA axis and the prefrontal cortex, along with other brain regions, work together as a team and communicate. When you work with somebody with prefrontal cortex dysfunction, executive function impairment, Equally important to understand how the HPA axis, when it does not communicate properly, can throw off our executive function. And if you haven't heard of the term executive function, it's the CEO of the brain. It relates to decision making, problem solving, reasoning, time management, organization. It's pretty important, like the most important thing if you want to function in society and hold a job, go to school and do well and manage money and drive a car. It's very important. The autonomic nervous system and the HPA axis are good friends. When they're not working properly, they're not communicating. There's a relationship breakdown. And when that happens, that throws off our body. So I encourage you, if you guys are interested in the topic, when Dan releases it, go back and listen to the autonomic nervous system talk. It really will help solidify what we're talking about today. This here visually, let's just break this down. So when the brain is under a lot of stress, maybe it's from a traumatic brain injury, maybe it's from whatever other kinds of stress, that can throw off our autonomic nervous system, so our body's not in balance. It throws off our HPA axis. And then practically speaking, what can happen? More migraine, headaches. You might feel more dizzy. You might have a lot of anxiety, panic attacks, and you might have a lot of digestive health issues, diarrhea, constipation, bloating. These are very, very important to understand and calm down if any of you or people are working with folks that are dealing with these things, because they're all interconnected. So the prefrontal cortex, we all know that. So another study that just talks about there's an intimate relationship between these parts of the brain, and not all of the HPA axis is located in the brain, but a big part of it is. And when we study this stuff, what do we need to be aware of? Not just the prefrontal cortex. We need to be aware of the hippocampus. Big part of the hippocampus is memory. We need to be aware of the amygdala. A big part of the amygdala is emotions. And when these systems are working properly, we can regulate our emotions better. We can have better self-control. We can stay more motivated. Our reactions to stress are better. On the flip side of this, when we have damage or dysfunction in these areas, it might manifest as more problems in these areas. Equally important is to understand the gut-brain axis. And part of the gut-brain axis is the microbiome, the microbiota. This is basically the communicator of the gut-brain axis. So what is the gut-brain axis? It's kind of a bidirectional highway that communicates with the brain and the gut. When it's working properly, our brains work better and our guts work better. When our gut-brain axis is off, we have more brain-based complaints and more gut health issues. In an ideal world, anyone working in brain injury rehabilitation would have extensive training related to the gut-brain axis, because the research is very clear on this. Help people with a brain injury improve gut health functioning. And if you do that, it's going to help improve brain functioning. It's very, very important. Not just to target like the traditional neural rehabilitative programs, which are very, very important, but if no one ever asks questions about digestive health, constipation histories, things like that, we're missing a critical component to intervention. And the gut-brain axis, there's a lot going on there. The enterotic nervous system is the nervous system of the gut. I think we all understand that the central nervous system, the autonomic nervous system, the HPA axis, and all kinds of other things. And when these things are working together as a close family, our mood is better. Our cognitive performance is better. Our skin health is better. Our sleep is better. So very, very important from a brain injury rehabilitation lens. Get training on these things and really infuse these interventions into the good work you're already doing. And the gut microbiota, what is this? Let's just break it down. There's literally tens of thousands of studies on the gut microbiota. It's a superorganism in our gut. Trillions of microorganisms live in our gut. It's part of the gut-brain axis. It's been referred to as a biometabolic interconnecting network. So it's a bidirectional pathway of chemical signals from the gut to the brain, and it influences brain function, behavior, and mood, and all kinds of other things. So calm the gut down. It helps the brain work better. A lot going on here too, but if you're interested in this, we'll go a lot deeper into this when we have that talk later on this year for Dan's group. How does the gut microbiota influence behavior? Well, look at all these systems involved here. Obviously, we're focusing mainly on five today, but you got to understand the vagus nerve. You got to understand the autonomic nervous system, our immune system, even the tryptophan metabolism, and our nervous system. We're not going to be able to get in the weeds with all these today, but I want to plant the seeds here once you get the slides. If you really want to take your knowledge to the deeper level, these are areas to look into.
Can I put a comment as per that figure?
Yeah.
If you go back one, so I think that, with brain injury, and it's interesting that you have the nervous system and HPA axis as separate. I get that, but also since it's interconnected, with the brain injury, the brain part is injured, because of the physical or chemical, whatever has caused the injury to that system, its dysregulation affects all of these. And the interconnectivity of these things, kind of Moz and I are chatting a little bit about this as you're talking, because it's super interconnected and for each brain injury it's different, but the brain injury part is already there. And then for those people who I have met and also clinicians I've been able to speak to about those who have injury to the HPA axis, literally injury to that, they have very clear manifestation of problems that through hormonal testing, or some have drastic weight gain was one thing that I spoke to somebody about. Then that they have particular types of problems, but the interconnectivity of it makes it hard to tease out and hard to figure out. But with the right help and also the right ruling out of figuring out what's wrong with yourself over time, um, I don't know. I just want to comment on that because this figure is good towards showing that interconnectivity, and gut the gut microbiota access to it as well is something that can improve it, but it doesn't necessarily fix what got injured in the nervous system, or if you have HP access due to brain injury, that's its own sort of mess that interconnects with all this. Just a comment.
Yeah, no, Dan, thanks. It gets tricky, folks, and these are all interconnected, but the more we can learn about this in the brain injury community and work with providers and a multidisciplinary team who understand these topics, maybe we've never learned about these things, and maybe we get some testing and we just correct the things that we can, and maybe it starts making gradual differences in the body. The influence of the HPA axis is many and varied, and these are a few things. So when the HPA axis is doing what it's supposed to do, it can absolutely have a positive impact on behaviors related to food intake, learning and memory. And when it's not working properly, we might have more anxiety and depression, to name a few. So when we have this chronic activation in the HPA axis, so maybe we're talking about a head injury. We have that initial blow to the head, but then the chronic activation happens after from not sleeping well, stress, tons of conflict with family and friends. Maybe it's from the food we eat. Maybe it's from excessive screen time exposure, and we just now have a fear of the dark, whatever it is. That chronic activation over and over and over again, spewing out more cortisol into our body. And that's another reason why maybe we're not able to get a good night's sleep. And then come morning, when our cortisol levels are supposed to be higher, maybe they're a lot lower. And that's a factor in why we're so tired and groggy and we can't get moving. A lot going on here from a neuroscience lens. So when somebody deals with a lot of HPA axis dysregulation over a long period of time, this can impact our cognitive health, our emotional well-being, and even from brain scan research, it may adversely impact gray matter volumes in the brain, to name a few. So just another reason why We should learn about this topic and have an appreciation for it. Any of you work in the area of mental health, and any of you work with folks with any kind of mental health diagnosis? And I mean, it could be depression, anxiety, PTSD, bipolar, whatever it is. HPA axis dysfunction, without a doubt, is activated in people with these mental health conditions. So a call to action, anybody working in the mental health field, including substance use treatment and trauma treatment, become HPA access informed, because probably 100% of your clients don't have an HPA access that's calm. Take a look at this here. This comes from tons of studies. What are some of the common populations in terms of diagnoses that dysregulated HPA axis functioning has been noted? Autism, fetal alcohol spectrum disorder, ADHD, major depressive disorders, various types of personality disorders, PTSD, kids that grew up with a lot of abuse, people with drug and alcohol diagnoses, chronic fatigue syndrome. I'm just planting the seeds here. It's not just brain injuries, it's all kinds of conditions. So, other things to be aware of. If you know somebody that has a ton of sleep issues or metabolic syndrome, diabetes, blood pressure issues, cholesterol, things of that nature, osteoporosis, hypertension, the list goes on, that should alert you that person's HPA axis probably isn't that calm. And another reason why we need to learn about this in all fields of study, to be honest with you.
Can I ask a question here?
Yes, of course.
Um, on these slides where you have these multiple diagnoses, I found in my personal experience that I've been misdiagnosed with a lot of those, because the physician did not understand brain injury, and so
Yeah.
they were misunderstanding the symptoms I was having as if they were in these other categories, which I knew I did not fall into. My father was a psychiatrist. I worked with him, um, from a child up, and he lectured me on these different things, so I had a kind of a casual knowledge of some of these things, but I knew myself mostly, and so that's been the disturbing situation for me in trying to find the clinicians that do have um, more understanding beyond what they're taught, because they're not taught um, TBI. Many are not taught anything about us. I just wanted to put that out there and wondered what your experience is.
Thank you for that. Yeah, it's spot on. Yes, misdiagnosis, underdiagnosis, overdiagnosis, all too common. What would happen if before diagnosing and going down that rabbit trail of giving all these labels, let's look at the gut. Is the gut off? What's going on with sleep health? What's going on with nutrition? What's going on with blood sugar levels? What's going on with their autonomic nervous system? I think that explains the manifestation of a lot of these diagnoses. If you calm those systems down, maybe some of those other behaviors really, really are more manageable. And then you don't see maybe these diagnoses as much. Again, everyone's different, of course, but that's just my own opinion. And I do see overdiagnosis all too common.
And I
Uh,
comment on what Moz said because I think what she says is very accurate and has been my experience as well. I've only met maybe two or three clinicians across the years that have the framework for brain injury. And also, I appreciate these slides because the dysregulation and dysfunction can happen in many different ways and have a manifestation because every brain injury is different. So I do like the way Jerrod presents these slides because it has this umbrella or large scope of problems that will manifest, but to think of it as having the same or similar underlying issues with HPA axis dysfunction is a way to think about brain injury across more than one person because it's such a complicated thing, but you could still have ultimately the same manifestation of problems because of what is underlying it. Jerrod calls it the root cause. I call it the core problems. I think that's a framework for thinking about brain injury for a population. So Yeah.
Yeah, thanks, guys. I appreciate it. Keep weighing in here. We're all here to learn from each other. So, and this slide here should really tie in to the question that was just brought up in the comment. When the HPA axis is really off, the person can have more anxiety and depression. They could actually present as more suspicious. It could trigger psychotic symptoms, attention issues. To the clinician who doesn't have training on that, well, could the client be diagnosed with ADHD or schizophrenia or all kinds of other things that maybe they have or maybe they don't? So look at how this can present clinically and practically in clients in some cases. And if you add a brain injury into this, it gets even more complicated. Just wanted to plant the seeds here. I've actually given lots of talks on this topic over the years. I love the field of brain injury rehabilitation would learn about this field too. I think it would revolutionize what we do. It's psychoneuroimmunology. It's a big field of study. It's been around for several decades. There's journals dedicated to this, but psychoneuroimmunology is where the mental health field should go, in my opinion. It's psychology meets neuroscience meets the immune system. It's just a mind-body approach, and you understand the human body on a way deeper level. Part of this field of study talks about learning about the HPA axis. It'll give you a better idea of the drivers for human disease and illnesses and dysfunction disorders, and then we can treat it more effectively. Psychoneuroimmunology has a lot to do with understanding the interconnectedness between our behaviors, our emotions, our immune system. Chronic pain has a lot to do with this field because chronic pain can manifest as behavioral problems and emotional problems. Takes into account cardiovascular factors and prenatal factors and early childhood factors and hormones and neurotransmitters. And it'd be great if medical doctors all had advanced training in this. It would really change the way we do medicine in this country, I think, for the better. Dan, I'll stop there for a moment if we have any thoughts, questions, anything you want to kind of weigh in before we get to part two.
The emotional output that happens because of these problems, I think that's a huge factor that people don't normally consider because I don't know if there's a framework for thinking about emotional problems without a brain injury or without a chronic condition. Something happens and then you have feelings about it. But this is like the something happens is the dysregulation of key parts of your nervous system that normally are balanced. So I just think that's important to consider. I appreciate that you said that. And but I have met a small number of people that could tell me about their hormone truly injured the HPA axis, truly injured that part of their brain, and then the trying to find a doctor to help them. That was a also very circuitous route for them, but usually it manifested as drastic hormonal dysregulation. Maz, you had something?
I have a friend that has TBI, and she had thyroid cancer, and I always wondered if it was related to her TBI. And so this helps me understand that. And I agree with a lot of what you're saying about um, how much is still needed for those to learn about these different systems and how they can be underlying some of the diagnosis and things that and then be treated if it's really, to get more accurate of what's really going on with our brains, our bodies, and everything. So thank you for considering all that.
Thank you, Maz. I appreciate you. All
Oops.
right, so this next section, not giving medical advice, but like if you want to share this with whoever and doctors and stuff like that, but just in an ideal world, what would screening look like? Well, if we want to screen for HPA axis dysfunction, it says we really need to take a biopsychosocial spiritual approach. Biological factors, psychological factors, social factors, even spiritual factors. This is a lovely article published in 2025, one of the best articles I would recommend reading as it relates to the HPA axis. Let's break it down here. So making this visual, what are some of the factors that can contribute to HPA axis dysfunction? There's a lot. Screening is intervention, in my opinion, because if you can know the things that make it worse, and identify them, then you can make changes to that and hopefully calm it down. So psychosocial factors, well, what's going on with emotions? What's going on with your social health, with your family, with your friends, your coworkers? This gets tricky here. Obviously, we're talking genetics, epigenetics, but there are plenty of people now around the country who are genetic counselors, and more doctors are doing genetic testing. That could be an area to look into. Dietary factors. One of my master's degrees is in applied clinical nutrition. I always say I'm not giving nutritional advice, but I'm very biased. I think nutrition plays a huge role in this stuff. So working with a dietitian nutritionist who really understands this, what's going on with the gut, working with a doctor who obviously understands the immune system, calm the body down with the things that are driving up inflammation. What about toxins? Well, if somebody's drinking a lot of well water or just water that's not good for you, if they're breathing in secondhand smoke, if they're living in an old house where there's a lot of mold or lead or across the street from a factory, those are environmental toxins that can throw off things. And then hormones. You can get your hormones tested. I have family members done that, and it's amazing the data you can get from that and learn and work with providers to kind of target those specific hormones. In an ideal world, anything you can do to get your stress down, that's a good thing. Fix the dietary imbalances. So this is where it gets tricky, but you work with a provider, a qualified like dietitian, nutritionist, functional medicine provider. Maybe you can get some food allergy testing. Maybe someone has a very narrow focused diet and they're not getting enough vitamins or minerals pertaining to a certain area. Maybe there's some food sensitivities. We know that disrupted circadian rhythms are very common among folks with brain injuries. So the more you can learn about that and work with providers to help move in the direction of a appropriate sleep-wake cycle. Dan, you and I have had some good talks about this. I know it's tough. I mean, HPA axis dysfunction can manifest as you go to bed, you're exhausted. You wake up at 2 in the morning, you think it's morning time, you go down and like look at the clock. How in the heck is it 2 a.m.? Your cortisol levels are off, your melatonin levels are probably off, and that could be driven by stress and a million other factors too. So other things to consider. So dysfunction of the HPA axis can manifest as abnormal cortisol rhythms. So you might like pop out of bed at 2 in the morning thinking you're wide awake. If you're under a lot of stress, and maybe in years past, you could handle that stress better, but now that same stress happened and you can't handle it that well, HPA axis is telling you that something's off. Your mood is all over the map. You just seem to get sick a lot more. You're getting colds and flus, and you just feel run down all the time and exhausted. This is how HPA axis can manifest in your day-to-day life. The causes, again, for HPA axis dysfunction are all over the map. Chronic exhaustion, people that work 16 hours a day and doing all kinds of things and you never take breaks. Social trauma, somebody that lives a sedentary lifestyle, they never get any exercise. Even excessive screen time exposure, particularly at night when the sun goes down, if you're glued to your screen, computer, gadgets, that in and of itself can throw things off. It's not just what happened after birth, but was there prenatal trauma? That's a whole nother can of worms. And then really dig into sleep health, and maybe there's some untreated mental health stuff going on, and even certain medications can throw this off. Other causes, again, loneliness is a disruptor of the HPA axis. People that eat lots of processed foods. So if you're going to the gas station every day or the drive-through or getting microwavable foods, they're good tasting, but your brain and body don't like them. So you get a ton of sugar in your diet, even lack of sunlight and not getting enough vitamin D has been linked with HPA axis dysfunction. And again, possible symptoms, different slide showing you from different angles. If you deal with a lot of unexplained nausea, a lot of unexplained dizziness, You just seem to have a lot of brain fog. You're spacey all the time. You can't seem to get the words out right. You got a lot of unexplained hair loss. It just isn't making any sense. Your blood pressure is really low every time you go to the doctor. These are potential signs of the HPA axis not working properly. And the list goes on. Look at all this, just comes from hundreds and hundreds of studies over the years I've gone through. You have, who doesn't like a lot of salt and sugary foods, but if you have an unusual high craving for lots of salt, lots of sugar, that might be an HPA axis issue. The skin tells a story. There's actually a whole line of literature related to the microbiota gut skin axis. A lot of what happens in the gut can manifest as some skin problems too. Poor circulation could be a factor. That's also a factor for autonomic nervous system dysfunction, low libido, thyroid issues, increased abdominal fat. So people that start putting, they have like a lot of fat around their gut. They just can't seem to get it off. Could be an HPA axis issue. How do we screen for it? Well, again, there's a million things that can contribute to this. Somebody getting bullied and teased, unmanaged diabetes, someone's dealing with discrimination or racism, head trauma, blood sugar imbalances, domestic violence. I mean, the list goes on. These are all studies that have looked at these different angles, so it does get complicated here. Other things you want to be aware of, again, work with providers, rule out metabolic issues. Metabolic dysfunction is elevated among people with brain injuries, the research says. Exercise is good, but be aware of too much exercise. You don't want to like do it to the point of exhaustion. And that gets even trickier when we're talking brain injuries, because now we're talking electrolyte stuff and sodium balances. You got to work with providers who really know their stuff with that. Anybody smoking cigarettes, that throws off the HPA axis. I hate to say, no way around it. What are the physical signs of HPA axis dysfunction? Lots of fatigue, even after getting a lot of sleep. Unexplained weight changes. You get sick a lot and it's taking longer to recover, even from a minor cold. A lot of gut health issues, sugar crashes, allergies. How's it affect sleep? Well, you wake up a lot at 2, 4 in the morning, probably something a little off with the cortisol. And I'm not saying like a one-time thing where you go to bed and maybe you're worried about something very situational, but if you're noticing that pattern, definitely. If you are relying more and more on daily caffeine to just barely make it by the day and function, that's what the research says. How does this relate to mental and emotional changes? You might have more anxiety now, even about just very minor things that never bothered you before. You have more emotional upsets, and it's harder to bounce back after getting really upset. Your memory is just not as crisp. You're having a hard time concentrating. Your depression is up. Behaviorally, again, you might have strong cravings for salty or sweet foods. You notice your caffeine, sugar, and other stimulant intake goes up. Your motivation is just down. You go to a doctor, what are they going to diagnose you with or say? Well, you got depression. Well, let's peel back the layers here. Maybe, yeah, maybe there's some depression going on, but if we look into the weeds, could it be HPA axis dysfunction driving the depression? Maybe you love your exercise, but now it's just so difficult to exercise and even get going for the day. Impacts our hormones, changes in sex drive, thyroid dysfunction. Anybody ever deal with temperature regulation issues? Like you're at night, you're just so hot, but it's freezing outside, and everybody else in your household is just freezing. And maybe during the day, you're just shivering. Your temperature regulation is off, and you got some changes in skin health that don't make sense. Maybe some HPA axis stuff going on. And again, look at it from an energy lens. Energy typically is going to be off. Your energy the research says may crash a lot sooner in the afternoon when we're dealing with HPA axis dysfunction. And you just can't sustain that energy through the day. And again, more reliance on caffeine. So HPA axis dysfunction can vary by stages. So maybe someone's in the early stages of HPA axis dysfunction and they're having hyperactivity in their HPA axis. This can manifest as anxiety, insomnia, irritability, weight gain, and high blood pressure. Over time, as that axis is activated over and over and over again, it starts becoming blunted. And now you have hyporeactivity. And now you're more sluggish. You're more depressed. Your blood pressure's low. You can't manage your stress that well. And then you get sick a lot more. I'm not advocating to go out and do these tests, work with providers, but these are some tests that you could go to their healthcare provider on or a functional medicine provider. And these are diagnostic tests that can be used to help look at the health of the HPA axis. Again, there's not like one test that says, hey, you have HPA axis dysfunction, but these tests look at different levels and cortisols and things like that. This is interesting too. What is an intervention strategy that's so, so important? And Dan, I'll park the brakes when we get done with this section. I'm almost done and then
Thanks.
open it. The foundation for healing of the HPA axis has a lot to do with the relationships we have with our providers and our family and friends. So if you're working with professional providers who are kind and nice and understanding and listen to you and don't dismiss you and really want to get to know what in the world's going on here, that is very, very healing to the HPA axis. Find a therapist who's very gentle and kind. Be around family and friends who are kind. I mean, just kindness and gentleness and empathy and validation is very healing to this axis. Here's a few additional tests. Again, I'm not advocating for any one test. Anyone is really interested in getting in the weeds here and working with like a functional medicine provider. There's a lot of things we can do to test for different domains. Now, what I will say, unfortunately, some of these tests are not going to be covered by health insurance and they're not cheap, unfortunately. And that's Western medicine versus functional medicine. I wish these tests could be done on every human being. It would give so many clues and we move in the direction of real healthcare, preventative healthcare, and finding things before it reaches the point of a boiling point. But a lot of things we can do, inflammatory markers, metabolic markers, gut panels. I have plenty of people I know that've gotten gut microbiome testing. Unfortunately, these tests are like $500 and you pay out of pocket. Oxidative stress markers, thyroid levels. There's so much we can do about this, but how often does the field do much about this? I don't think that much, unfortunately. I just wanted to plant the seeds here. I do a lot of work in this area too, the first 1,000 days of life, in case any of you are interested in early childhood development stuff. What happens between day one of conception up the age of 2 also has a lot to do with how our HPA axis is going to work later on in life. So what happens to us in early childhood if somebody grew up unfortunately and had a lot of not so good stuff happen to them? Abuse, neglect, hardship, foster care, termination of parental rights. Research, unfortunately, is very clear. A lot of these kids, as they get older, they may have a very sensitive HPA axis. Full disclosure, when I was a kid, I got teased and bullied so bad for multiple years in 3rd and 4th grade. I know without a doubt, as an adult, my HPA axis is very sensitive. And I think it's because of those experiences in childhood. We all know probably about the adverse childhood experiences, but we have to have an appreciation for what happens to our clients and to all of us in childhood. And the research does show lots of adverse childhood experiences does throw off the HPA axis. It can impact the hippocampus. It can lead to more amygdala dysfunction, epigenetic changes. It's a big deal. I do a ton of work in the ACEs research. And if you're still on the fence, why you want to care about childhood trauma? Well, tons of childhood trauma equals a lot of times fractured attachment patterns. And when we have these things going on, research says it can impact these very, very important domains here. Work with providers who understand attachment. This is another intervention. Fractured attachment patterns set us up for more problems throughout life. There's no way around it. Work with providers who really understand this and help heal those attachment patterns that got fractured early on in life can actually calm the system down. And why do you want to care about poor attachment patterns early on in life? It has been linked with more chronic pain issues as we get older. It may increase the risk of cardiovascular issues, and it drives up inflammation-based illnesses. Toxic stress, allostatic load. This is wear and tear in the body if we're dealing with tons of stress. It ages us prematurely, and it does throw off this axis. You can see here, you'll see my slides. There's a ton of things that can cause chronic stress. And we need to figure out ways to bring our stress level down. This is so, so important. I'll let people look at this and then we'll answer questions and then we'll get to the positive stuff in a few minutes.
Yeah, positive stuff and what people can do to improve. That's a big question with all these. Maz, you have a question?
So in the chat, we've been kind of sharing that a lot of us felt like and feel like we've been reset to like our younger self. Um, After the TBI. And I know I watched my brain go back to specific scripts of when I learned specific things to try to relearn them. So I was trying to relearn from what I learned to begin with. But then, there's, when you talk about the development, so a lot of us, being set back to like 3 years old or 4 years old or whatever the case of what we remember emotionally, we're in that place. And it's hard to find a, so there's our difficulty from the challenges from what was injured, but then there's our reaction to those difficulties and reaction to the environment of how people are reacting to us. So having a doctor to dismiss or put you in a different category than what's accurate, so they're not really helping you, has been really a challenge. And so it'd be interesting to have research and study and talk about us having to live as adults in a kind of a partially very young mind, and how to deal with psychologically that way and to help us that way in that part of our recovery. Often only specific pieces of recovery are looked at, like cognitive compensation and things like that, or putting us on psychiatric medication, which makes things worse because it's not really getting to what we are dealing with. So that I just wanted to bring up what we were chatting about, and you're talking about the development and how that really is really very important. I didn't realize that and until you started talking about it.
Maz, I appreciate you for saying all that. I'm sorry you've had to deal with all of that too. And I give a lot of talks to different groups, and I always talk about it doesn't matter when you're talking interventions on how old the person is based on their date of birth. Let's look at it through a social, emotional, developmental lens. Let's tailor our approaches. Dan, you and I have had some good talks about Lego interventions, and I think I could be wrong, push back on me, folks, but if we started infusing Lego-based approaches, play therapy, art, music, jigsaw puzzles, I'm actually putting together a training on the therapeutic use of jigsaw puzzles. That would be a nice way to teach some skills that are practical for folks with a brain injury. And there's good empirical based literature on the use of those non-invasive 3D visual tools. And if a doctor would use them or a therapist, it would only enhance the good work they're already doing. And it's a kind of a form of mindfulness. And Dan, you've brought up some limitations to that, but feel free to share anything you think about that. But I do think it would be worth
Yeah. I see like for every person that has a brain injury, we have brain injury specific problems. And in my other podcast, Experiencing My Brain, I record discussions with people about that in detail because so far every brain injury person I met is pretty aware of what they're dealing with internally. Of course, it's not an awareness that is clear. You have to figure it out based on trial and error. And the play therapies and the play type approach, I think, is pretty has a lot of potential and pretty amazing towards improving what got injured, damaged, deleted, made harder to use because of the brain injury. But I wanted to say I agree with Moz, and I have been living with, the stress. Like in the beginning, I had double vision and cognition really wasn't there, and my mind felt like it wasn't my mind. I really was like a toddler. The development is a way to look at it, but it's injury to capacity, and then you have to like regrow it or rebuild it. One brain injured person I talked, she described it as redeveloping it. And yeah, it's just a crazy process. The other thing I was going to say is the attachment theory professionals that I have met when I was trying to deal with my alexithymia with brain injury, they didn't believe that alexithymia was a thing, and it was really weird because it kept happening over and over. Their frameworks for attachment theory, which is well established, also PTSD, I had to like prove to them that alexithymia even exists, and they didn't really help me. So that was very frustrating. Consistent with the professionals not knowing how to think about this. But I appreciate what Maz says. Maz is very good at articulating these things, and I know a number of people here who fit into that. Although every brain is different, we fit into that same boat of not getting the right help and then having to fight for it. But the ways, the play therapy and incorporating that into a day to day, I think it has a lot of potential. I only heard about Lego therapy through you and then one brain injured person I met who actually uses it. Any other questions, Kim?
Can I just say, there was
Yeah.
a place called Brainworks that had like the classes, music therapy, art therapy, all these different things. And it was fantastic. But the best part about it was that we could interact with each other and share what we were dealing with. So it wasn't just the action of doing those different what you consider alternative therapies that are cognitive related, but it's the group environment, like a group therapy sort of situation where, because we feel like we're isolated, nobody understands us. And when we get together, we actually understand.
Yeah, community and
And
connecting
so,
with other
so
people. Yeah.
doing those things in that environment and kind of, a place where it was safe because, there was therapists around, making sure everybody was safe, was really a fantastic place. And I'm sorry that it's not around anymore because I really, after 35 years, benefited from it, and still miss it to this day. And this is the closest in us, getting together and kind of sharing around different topics, that I have now.
Yeah, sadly, because this is online, it would be great to be in person, or I can relate with that totally. Kim?
Really good points here. I fortunately held on to my art, so that has been my lifeline. I do agree that in sharing the hands-on for me works very well. My learning style now post-accident, which a lot of therapists do not take into consideration learning style, which can change after accident. So mine is drastically different than before accident. So I before accident I was high dominant visual and high dominant kinesthetic with so-so auditory, but I had mapped 57 years. I had mapped in being quite highly functioning in all those levels of learnings because I had created the bridge and the maps for that. Post accident, that scaffolding was totally down in my processing. So my processing now, or my learning style now, is low dominance visual, low dominance auditory, and high dominance kinesthetic. So in the last year or two, I'm being able to sense my body and what it is doing better than I could for 10 years post-accident. I wasn't even connected to that. So I feel like I have an opportunity with my kinesthetic. It's not stellar by any means. It is really low on the totem pole, but I have something with my kinesthetic awareness and abilities to do some primal processing with that to hopefully, with the right guidance, facilitation, to build efficient and proper proper restructuring within myself and my mapping, but nobody seems to be listening to what I've been asking for. So I just want to say that, yes, I agree, having a community and having witnesses to be able to share hands-on for me interactions of something that is relatable within my systems now and trying to remap is really huge for me. I do know that I'm 11 years post accident. I do know that when I was with a physical therapist that had me do bear crawl, if you're familiar with that, that's like
Yeah,
a
yeah.
preschool type of
Sure.
movement. My body lit up. I was so I had a knowing at that time that person was meeting me at my level to build from, but it was a quick through. She didn't get it. My body got it. So my body definitely reacts when I'm at that primal level of developmental juiciness within the neurons to do something, but everybody skips past because I look fine and I talk at this point. I push myself to talk adult, that they're not meeting me at that level to build the neuroplastic bridges to be able to have that foundation at my true post-accident processing level. That's not obvious. That's all I have to say right now because I'm
Yeah.
going to start babbling with my brain injury.
Well, I would love to talk more about that because I also had a what you just described is consistent with what I called experiencing my brain or the perspective that I built of myself to make sense of what was injured to then improve it. And the 7 to 11 years that it improved, it was like a redevelopment and finding the niches that's like, oh, this is where I'm at is super important. I'll send you another talk or I'll put in the link of a developmental approach for movement. Jerrod, I know we have, I don't know how much time you have. I know we're getting close to an hour now. I wanted to ask if possible, you were mentioning the stages of the HPA axis injury. And I think that staging is very important because for a lot of brain injury stuff, there's a progression. So Jerrod, I guess the question real quick.
It's different for everyone. So early stages, hyperactivity,
Yeah.
maybe it hasn't been activated that long. Maybe it's something new going on. And again, everyone's going to be different. But maybe in those early stages, you're going to see the stuff here. Then, as this activation goes on for a long period of time, it starts short-circuiting that system and it becomes blunted. So now we're not having proper cortisol secretion. We have hypoactivity, so we come off as more sluggish. And then it can look like this. And again, it's not going to fit into these perfect boxes, but this is just one article of many. But this here, you're going to see this more common among kids with complex trauma. They grow up and they're abused day in and day out, year after year. Their access becomes short-circuited. This is going to be common among a survivor of domestic violence, unfortunately, who's been in domestic violence situation year after year after year. And the system just short circuits and doesn't work anymore. A lot of times, like a lot of you probably heard of adrenal fatigue, things like that. It's really HPA axis fatigue. It's not adrenal fatigue, it's HPA axis fatigue. So a lot of this stuff too, you're probably learning more about because of post-COVID stuff. You find all kinds of articles talking about like post-COVID and fatigue and chronic fatigue syndrome and brain fog and all of that, which yes, that's a component, but you really got to understand HPA access when you read articles about that stuff. Dan, if you okay, I'd like to get to the good stuff. I'm just gonna jump through just a few things here, the interventions. So the way we live our modern life, it's not that good. Let's just be honest. Fast food, junk food, go, 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 not getting good sleep. The modern way of living is not good for our HPA access. People that eat the Western diet, this is processed foods, junk food, candy bars, sugar sweetened beverages, fast food, all good tasting food, but again, not good for the brain and body. This dysregulates the HPA axis. Another intervention, really be aware of your sugar intake. Excessive sugar consumption is not good for our HPA axis. Get our sleep under control, work with a sleep specialist, screen for this, rule out any sleep issues. Very, very important component of this. Again, back to the circadian rhythms. Really be mindful of our circadian rhythm. And when the HPA axis is off, it can throw off our circadian rhythms. And why do you want to care about circadian rhythms? Because when we have chronic disruption of our circadian rhythms, this is another big piece of this puzzle. And Dan, we did a talk last year on TBI and circadian rhythm misalignment. Circadian rhythm misalignment has also been linked with increases in depression and alcohol addiction and pain issues and HPA axis dysregulation, all kinds of stuff. People are surprised to hear this, but circadian rhythm misalignment, gut health plays a huge role in asthma and breathing problems and the urge to cough. It's fascinating and disturbing stuff at the same time. Rule out sleep apnea. I know many, many people with sleep apnea. Screen for sleep apnea. Get that under control because untreated sleep apnea throws off the HPA axis. Metabolic syndrome, cholesterol issues, having more visceral fat, a lot of fat around the gut, having just triglyceride stuff going on, type 2 diabetes, cardiovascular disease risk factors, targeting that is very, very important. There's a lot of things that can impact metabolic syndrome, what we eat, tobacco, even HPA axis dysfunction is a player in metabolic syndrome. Most Americans are not metabolically healthy. That doesn't mean you have metabolic syndrome. If you have metabolic syndrome, you're going to have at least, I believe the criteria is 3 of the 6 metabolic markers. So you might have high blood pressure, high cholesterol, and in glucose issues. That could be metabolic syndrome. It gets more complicated than that. Drug problems, alcohol problems impact the HPA axis. Nicotine, again, also does. Sorry, we're moving fast, folks. I want to get to the last section. Here's one we don't think about. If you live in an environment and you are constantly hearing a lot of noises at night, traffic, you live across the street from a factory, you live across the street from an airport, those noises jolt the system. It's an endocrine disruptor and it's a disruptor to the HPA axis. Earplugs might be helpful. Food insecurity, a huge driver for HPA axis dysfunction. Food insecurity is alive and well in this country, unfortunately. Dan, I'm going to push through and then I can stick around with questions. So, okay, what do we do about this? Well, how do we successfully manage HPA axis dysfunction? We need integrative approaches. We need more awareness among healthcare providers, behavioral health. We need thorough assessments and we need a holistic perspective. Here's some integrative approaches that are supported in the literature. Mindfulness-based exercises. Moderate exercise. You don't want to overdo it. You don't want to underdo it. Dietary modifications. I'm sure some of you have heard of the topic of adaptogens. Those are big things. You can get drinks with adaptogens and teas and mushroom powder, all kinds of stuff. Don't go out and do this. Please talk to your healthcare provider, but this is what the research says. Certain supplements can be very, very helpful to support HPA axis functioning. Here's a specific article in the TBI literature that talks about the need for psychosocial interventions to regulate the HPA axis. So really improve social status and stability. Maz, the group you were talking about and the connectedness to that group, that falls in line with this study. Yes, being around people who understand and you feel accepted and heard and valued and known, that's an HPA axis intervention. Forming that strong therapeutic relationship with your providers, again, as I mentioned before, has a lot to do with calming the axis down. If you have providers who are dismissive and it's their way or the highway, they don't listen, they interrupt, they rush you, and that's traumatic. That's confusing. That's not good. And those feelings throw off the HPA axis. Mindfulness and meditation-based approaches are supported in this literature. Working with therapists who understand this and use cognitive behavioral approaches, that can be helpful. Emotional freedom techniques. We have any therapists here who use these? Love to hear from you. Enhancing social supports and really enhancing those lifestyle approaches. Dan, my memory is not good today. Did we do a talk on lifestyle medicine? I think we did. That goes to the heart of this here. Trauma-informed care approaches without a doubt are needed. Brain injuries, non-brain injuries, attachment issues. Trauma-informed care is basically when that organization understands trauma, does everything they can to not re-traumatize their patients. They're mindful of their language they use, their approaches, the lighting, not rushing people. They're more kind, they're more empathetic. You have a collaborative approach. Trauma-informed care approaches is another intervention.
And that one was the one we discussed. Trauma-informed care for brain injury needs to get the brain injury part of the trauma, which Kim is a person I've talked to about that. Moz, I think every brain injury person we get into that directly because that understanding or space to listen and be curious is super important.
Absolutely.
Yeah.
This study was more geared toward parents of kids, but I think it's parents, anybody of any age. I mean, caregivers, we're just warm and gentle and kind to their young kids, to their teenagers, to their adult children. That's a good thing. And that way of parenting calms and soothes the HPA axis. If you have friends like that, you feel better. If you have friends that are just kind of snappy and mean and dismissive, how do you feel inside compared to a friend who's warm and empathetic and kind and ask a lot of good questions? Resilience and HPA axis functioning go hand in hand. We all know about resilience. When you study resilience, there's a lot of neuroscience and biochemistry things at play here. And the research says you want to increase resilience in people, understand the immune system, understand the brain and the HPA axis. That's why the field of psychoneuroimmunology is so important to understand because it really takes all these things into account. Look at all the factors involved in resilience here at the individual level. Resilience is like a force field, a protective factor. The higher level of resilience we have, we're typically in a better position to bounce back from difficult things. The more you can understand these dynamics at the individual level and help people improve them, we're in a much better position to be able to handle things more effectively. At the social level, again, joining a positive support group, feeling like you belong, improving your financial resources, maybe getting connected to a church or spiritual group if appropriate, learning about just building trusting relationships, getting in a housing environment that's calm and stable. These are all things at the individual or at the societal level. And at the environmental level, here's some other things. Make sure you have good health care, good medical care. Marginalized groups feel like they have a voice and they just feel like they're included, and it's a strengths-based approach. So mindfulness, I know some people have brought this up in other talks and stuff, but this is an article of many that does talk about utilizing mindfulness-based approaches can buffer and support the HPA axis. And just looking at this in terms of what some of the meditation literature says, engagement in meditative practices, and there's a million ways to do this. You could sit still, you could do it on a walk, it could be listening to soft music, there's so many things. But it can help regulate the HPA axis. It's a good thing for the immune system. It's a good way to reduce headaches, the research says. It's a good way to calm down the nervous system. Here's something we don't think about. Go to your dentist if you have dental problems, teeth problems, chewing problems. That's another piece of the puzzle here. And this is an area to target for HPA axis dysregulation. The dentist can play a role here too. Here's a good reminder. I like this: adaptive self-regulation and health and wellness goals. The more you can work with providers who really capitalize on those lifestyle medicine approaches and really then target some unhealthy lifestyle practices, this is good for any human being. and learning about reprisal and submission. So you work with a therapist maybe, and you work with a therapist on these topics. They typically would work with a client on emotional regulation, improving coping strategies, social functioning, focusing on self-esteem dynamics, improving problem solving. Music therapy can play a role here. Working with a music therapist is just one article of many that does talk about working with a music therapist who understands the nuances of this stuff can really help soothe the brain and calm down the nervous system and the HPA axis. Dan, I think we did a talk on neuroplasticity last year, and when you study neuroplasticity, it's very important to also understand the role and impact that the HPA axis has on this. So if the HPA axis is constantly off and dysregulated, that can adversely impact neuroplasticity. And neuroplasticity really goes to the heart of brain injury rehabilitation. And equally important, if you are a professional, a caregiver, whatever role you play, burnout is a threat to your HPA axis. If you are burnt out, be aware that burnout symptoms are HPA axis dysfunction without a doubt. We've all dealt with burnout on some level. If you're in school, if you're dealing with a brain injury, we all get burnt out. So
Yeah, burnout with brain injury is an understatement because of the fatigue and the combination and the accumulation of factors in the neuroplasticity talk. That's the thing that I was calling the downward spirals that comes with brain injury, but it's yeah, just I look at it as an amplified version of that. But of course, to try to avoid it is crucial, or avoid it as best you can. Yeah.
or acknowledge, hey, I'm burnt out. I need a break. It's okay. Ask for help. Disconnect, you know? We all need days off. We all need breaks. Go have fun, go for a walk. Well, I mean, whatever you do. And we all know these things. If you're working in the healthcare field, if you're working in the helping profession, you got to be aware of vicarious trauma, compassion, fatigue, and burnout, all these things. And the more the professionals can take care of themselves and not have their HPA axis all out of whack, then they're more centered and grounded and more empathetic and kind to the patients they serve. And here's some just burnout recommendations for professionals, but we can all learn from this and stuff. But if you're go, go, go 7 days a week and you're not ever taking breaks, you're going to get burnt out. And our world is crazy and there's all kinds of stuff going on. And the more we can slow down, have work-life balance, find a group to connect to, find a hobby, whatever it is, whatever we can do to manage this, this could be a good thing. And as we get ready to wrap up, so if you were to go through hundreds of studies on the HPA axis and you look specifically at intervention strategies, all this stuff is common sense, but it's a good reminder. You go to a therapist who you really like, that's an intervention. Laughing, having a good sense of humor is talked about in the HPA axis intervention literature. Reduce caffeine. Be aware of being around people who really are truly empathetic and validating. Finding quiet time to slow that brain down. Developing a sense of belongingness. Yoga can be very helpful. Getting better sleep. Gratitude, optimism. Going for a massage is talked about in this literature. Journaling. Self-compassion. Deep breathing. Eating an anti-inflammatory diet. Getting out in nature. Just sitting around green space is an intervention for your HPA axis, the research says. Thank you, folks. Sorry we went over. Great questions. I'll stick around, Dan, if we have any more. And here's my email, folks. Reach out if you want any resources on these topics. I have many.
Thank you, Jared. And yeah, so we definitely have gone over, but that's how these tend to go. Thank you, Jared. This was very informative. There was one question about HPA axis, I guess, injury and dementia, and I guess the chat's so long I can't find it, but how, if anything, does this contribute to, dementia or other conditions like that?
I won't, so let's take out the word dementia and just put in like neurodegeneration. And What can speed up the aging process in the brain? Well, you want to look at allostatic load, so wear and tear in the body. We want to be aware that, remember that slide I showed you on chronic stress? And if we're dealing with chronic stress, it just ages the brain. And if someone's dealing with HPA axis dysfunction, they're dealing with more neuroinflammation. They might crave more unhealthy food. They might live a sedentary lifestyle. They might have more problematic lifestyle habits. All of that can lead to a progression in cognitive decline over multiple decades. Does it directly cause dementia? Probably not like directly, but indirectly. Look at all the factors involved that we've talked about here today. So yes, that is a piece of the puzzle, including the gut microbiota. What I will say about dementia is there's a lot of interesting research being done on the gut and sugar and diet. And the more you can understand those topics, and dementia is a really complex topic. I mean, there's thousands of studies coming out all the time, but calm down your nervous system, calm down your HPA axis, get the gut under control. It's going to help your brain feel better, think better, and live longer and slow down the aging process.
Yeah, I think that indirect versus direct distinction is super important, and I also view it as a many of the brain injury problems can indirectly lead to dementia and worsening of factors because of the brain injury problems both accumulating and if you don't get specific help. In line with that, there's a question about CBT, cognitive behavioral therapy with brain injury. I'll read it, although I don't know what this acronym is. It says with FASD, we often teach
Mhm.
this. What is that?
Yeah, yeah. Fetal
Oh,
alcohol spectrum disorder.
thank you. I was
Yep.
not familiar with that. We often teach that CBT is not recommended unless it's trauma-informed CBT with additional accommodations. Can you elaborate on this from your perspective?
Straight CBT would not be recommended, but if you were to pair cognitive behavioral approaches with visual approaches, concrete approaches, maybe you pair it with a Lego-based intervention, a puzzle therapy, you match the client's developmental, social, emotional age. Because if we just talk FASD, we know that a lot of folks with FASD function half their chronological age. So we need to be aware of the vocabulary we're using. Those would be very, very important things to take into account. If we can make it visual, make it concrete, not just teach it in a controlled setting, but then teach the skills from a more like a psychiatric rehabilitative lens, like coaching, modeling, teaching, role playing. Practice the skills learned in the office, but then teach how to generalize it to multiple settings. Because also often with folks with FASD, they go to a therapist. They present very competently in that controlled setting. The therapist then thinks, "Oh, okay, everything's great." The minute they leave the office, they can't apply it at the playground, at home, at school, or at the job. That's a generalization deficit. Part of that's rooted in adaptive functioning deficits, executive function, theory of mind, all kinds of stuff. But the more you can understand those moving parts and then make modifications, I do think CBT can be effective, but not on face value. It has to be done by a clinician who knows these nuances and can make those tailored approaches. I do a lot of consulting with group homes, and we always talk about how do you teach a skill in there to clients that might have a neurodevelopmental disorder, neurocognitive. You teach the skill verbally, you role play it, maybe you find a YouTube video, you watch it that has something to do with that skill so you can see it visually. Then you break it down, master the skill in that location. Then you go outside and practice it again. And then you go to the mall or you go to this place. You start practicing it and you look at it through the long game. This is not something that's going to be learned doing one or two times. You got to do it over and over and over and over again. It might be hundreds of times. And that gets the heart of rote learning and neuroplasticity as well. And metacognitive approaches would be highly recommended too. So using some metacognitive based approaches can be very helpful.
Yeah, I also had that experience of having to actualize it, functionalize, to translate something from what you learn initially to the real world requires many, many repetitions. And I think the CBT can help to a frame to a certain extent, but it needs to be paired with the other brain injury issues being if not managed, also try to improve. And that can be complex for each different brain injury.
Uh, yeah, what you were saying about having to do it over and over again, I also experienced having to start over many times. So
Yeah.
when things change, like I moved to a new place or, something major happens, it's not just picking up, where you left off. Literally have to go back to the beginning and start over again and build from there. So it's for the clinicians to understand that, to support that. I mean, they say mental illness is, not a straightforward path. It's, circular and winding and stuff. But we're 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 different from mental illness, but yet um, that partially is almost an understanding. But people with mental illness, they don't have to completely start over from like a 3-year-old level and start building back up again. uh, there's limited support for that kind of perspective.
Next
Yeah.
year or in the upcoming season of this, I guess, I'm gonna do a panel with brain injury survivors about brain injury underlying mental health problems because what you just said I see as a continuous that happens often. You don't need to save that thought. It's like we're dealing with this for decades. So Jerrod, did you have a something to say or I feel like I cut you off?
Oh, no, 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 definitely. Great comments, folks. Yeah.
Yeah,
Anything else I can answer, let me know. If you think of something after the fact, shoot me an email, and here's my email.
great. Thank you very much. Sorry that you're sick. Thanks for giving such a comprehensive talk while having a cold. Okay, everyone. I think if there's any more comments, I think I we should go because it's been a long session. So I'll okay.
Dan, can I mention something real quick?
Yeah, yeah. Who's
Sorry,
talking?
it's a new format on the Zoom for some reason, so maybe it's a different
Oh,
type, but I was struggling to figure out how to ask a question, then I couldn't find the hand raiser, so I apologize for that.
oh.
No, I just want to point out if there is clinicians on, they need to realize what the physical impact of TBI does to us, because I was always 2 years advanced in English and math, and now it takes 10 or 15 times of repetition for me to even begin to potentially remember the thing I'm supposed to remember. So it
Mhm.
really does impact attention, memory, executive function, everything. So I'm not who I was pre-accident from the injury. So I just want clinicians to be aware of that. It's constant repetition and lots of it for us to even begin to have it sink in. So that's a pretty
Yeah, that
tense thing.
that encoding issue, it came up in one of these talks, and I had that. It was like repeating things 12 times or so, writing it down to get it into my head to begin the process. It was very strange, but um, there's one talk in this series that the professional has discussed that, but I don't know if he had experienced it. I know that I did. So yeah, that's only the start of it.
You're not
Okay.
alone.
I do appreciate the same pageness that everyone is sharing here. Thank you, Jerrod. This was really good, and I'll get these talks out in the next few weeks. Expect a poster for the next round. I'm gonna send that out hopefully by end of today. Okay, everyone. I think we
Thank you,
should.
Dan. Thank you,
Thank you,
everyone.
Jerrod. Thank you. All right, everyone. Thank you. All right, I'm gonna end this. Bye. Bye. Oh,
Bye.
I can't do this, right?
Oh,
End me.